Assalamu alaikum warahmatullahi wabarakatuh. My name is Dr. Lubna Walim and I'm a medical doctor. Besides this, I volunteer at regular school for science Olympiad coaching, and I also volunteer at Sunday school. So today in this video, I'm going to discuss emotional challenges of puberty and how to overcome them. And this presentation is for both parents and teenagers. Before I start my discussion on the topic, I would like to share the fact why did I choose this topic. Actually, I felt like I was deeply touched by the news of uh, suicide cases in my city and in nearby cities also. In the last 2 years, I heard like about three or four cases, suicide cases among teenagers, especially high schoolers. So I felt responsible, like I felt that I should educate as because I'm a doctor, and why not educate the medical perspective of uh, these physiological changes around puberty. So that's why I made this presentation. And actually, I made this presentation about a year ago, and I presented in a local um, girls' halakha, girls' halakha for teenagers. So I already presented there in person, and now I'm making a video uh, so that I can share uh, the same discussion with others too. So in this discussion, the contents included are first, a very brief overview of phases of human life, and then a pictorial depiction of childhood and puberty. And then I'm going to discuss the basic physiology behind puberty and other related emotional challenges with the puberty. Uh, and then I'm going to discuss each challenge one by one. Uh, then then specifically an overview of physiology behind crushes. And then we are going to discuss religious aspect of this discussion. And lastly, take home take home message. So So the phases of human life, almost all of us know that they are. We've all passed through different phases in our life: infancy, toddlerhood, childhood, adolescence or puberty, early adulthood, middle age, and then old age. I'm not going to go in. I'm not going to discuss each phase in detail, but rather I would like to show um, a slide with some pictures, and then we can discuss. Yes, this slide, and these pictures, uh, these pictures, uh, we can very well see that it's pictures with happy family time, pleasure time, like with parents and grandparents, and you can see everywhere they are enjoying, they are having fun. So and this is typical of almost every family album when with kids of with kids like uh, whether they are infant or toddler or early childhood. So we see all these uh, this kind of feeling and emotions in our family albums. Then, yes, this is the next phase from after early childhood. This is the phase puberty. So why I choose these pictures? Just to these are real pictures. Uh, and I chose this picture just to depict what happens around puberty. You can see like anger, you can very well appreciate um, despair, hopelessness, anxiety. So uh, all these things happen around puberty. And like one phase, the first three phases of human life, we can see we can appreciate all these happiness, pleasure, and these things. And then the next, what happens around puberty um, that causes these kind of emotional changes. So let's see, let's discuss the physiology, the processes behind these emotional challenges, these emotional changes. Why do these, okay, our question is, why do these changes usually happen around puberty? And then we have another question, what's the source of these emotions? So mostly like when it comes to emotions, most of us feel that heart is the source of these emotions. But actually, it's not. Like physiologically, it's a brain that's the source of these emotions. And in this slide, um, in this slide, this is demonstrated that the seat of all emotions are there in the brain. This is the schematic diagram of a human brain, and the part that is responsible for our emotions and our involuntary action, temperature regulation, things that are beyond our control. So that part is this embedded part within the brain, which is called a limbic system. Limbic system is a system of connected neurons and pathways. And among these pathway and neurons, this part, this condensed part, hippocampal gyrus, is important. Uh, and the front or the interior part, dilated part of hippocampal gyrus is called amygdala. And this amygdala is considered as the seat of all emotions. From side view, it is over here, and from the schematic diagram, you can see it's over here. So here are some facts about amygdala. Amygdala is two, and singular is amygdala. Amygdala are parts of the limbic system in the brain, and limbic system is responsible for emotions, survival instincts, and memory. Each amygdala in human plays a role in emotional reactions such as fear, anger, hope, or despair, and also sexual activity emotions, sexual emotions, and libido. Uh, Amygdala is the integrative center for emotions, emotional behavior, and motivation. So not only it has a role in initiating these emotions, but it is the integrative center for emotions also. And it's a fact that lesions in amygdala result in lack of emotional response. So this is a clinical fact. What specifically happened? Okay, so one thing, if this structure is in the brain, the amygdala and the hippocampal gyrus. So if amygdala is there, amygdalae are there in the brain, right from the birth. What specifically happens at these structure around puberty that causes changes in emotions or thinking pattern? So why at the time of puberty? Yes, we know that at the time of puberty, there is a sudden rise of puberty hormones, estradiol in females and testosterone in males. And these hormone increase 20 to 30 times from their from their baseline. So the increase at puberty is 20 to 30 times, right? So obviously, uh, with puberty, the gonads start producing either estrogen or testosterone in a cyclical manner. These hormones, while circulating in blood, also pass through hippocampal gyrus, amygdala, and other nuclei in the limbic system, resulting in some peculiar teenage emotions or behaviors. And because the hippocampal gyrus or amygdala are exposed to the very high concentration of these hormones, so it is considered that as a result, teenagers either experience some emotional changes in their own behavior or people observe some changes in them. So these changes can take different forms. Uh, there can be mood swings or emotional instability, or there are episodes of anger or unknown fear or despair. And there can be changes in thinking pattern, initiation, and around puberty, also initiation of sexual inclination. So these are some of the changes that happen around puberty. Now that we know the mechanism behind these emotional challenges, we can discuss about each emotional or behavioral challenge one by one and try to find solutions to overcome them. So first in my list is mood swings or emotional instability. Basically, with the commencement of puberty, the body itself has not become used to high fluctuating levels of hormones. We just, like in the previous slide, we just discussed that the rise in hormonal level is 20 to 30 times suddenly. Like at menarche is the onset of, like menarche is the puberty, commencement of puberty in girls, and adrenarche is commencement of puberty in boys. So with the onset of puberty, commencement of puberty, there is a sudden rise of hormones 20 to 30 times. And the body system and the brain both need some time to become used to or to become acclimatized to fluctuating levels of hormones in the circulating blood. And the conditions we know that uh, conditions like PMS, premenstrual syndrome, that happen among girls of this age. Um, and the symptoms are, we know that mood swings, food cravings, fatigue, irritability, bloating. And these are very common, more than 3 million US cases per year. So this premenstrual syndrome is because of hormonal fluctuations in girls. And there's a male counterpart too, which is termed as irritable male syndrome. Actually, when I was like When I was studying physiology in my college years, I came to know that it's not only females have a cyclical pattern, a hormonal periodic pattern, but males also have. But the cycle is not that sequential, not regular, and it's unique to every person. Like every male has a unique cycle. So this irritable male syndrome is like the definition is a state of hypersensitivity, frustration, anxiety, and anger that occurs in males and is associated with biochemical changes, hormonal fluctuations, stress, and loss of male identity. So this definition is from internet, and let me show the source of this definition is from an article from medicinenet.com, and here is the live events transcript, WebMD live events transcript, and the event this whole event was presented by a psychotherapist, Jed Diamond, and he calls this phenomena as irritable male syndrome. So this article and this study is really based on 40 years of, he said, Jed Diamond said, this is really based on 40 years of my own clinical research, as well as responses from 10,000 men. And so he described this. So it's not in short, it's not only this is not only females that experience hormonal fluctuations and these conditions, PMS. So there is a male counterpart too. So both boys and girls, they encounter the hormonal fluctuations in the body. So as we know that these things happen in the body. So if we know that something going on naturally inside my body, so if we know, if we have insight into what is going on, we can control our emotions. So not only the person who is experiencing, but if parents and other people are around youngster, if they just realize and appreciate this basic fact about human physiology and ignore some derangements in their behavior pattern, a number of social conflicts could be avoided among families and among different groups, right? So because there are bursts of anger, because there are bursts of there are mood swings happening. So if parents, family members, and teachers, if they just ignore, if they just ignore the derangements in their behavior. So, and this hikmat, this wisdom is also mentioned in Surah Taqabun, which is Surah number 64, ayat 14. And Allah subhanahu wa ta'ala instructs parents to overlook and forgive deranged or offensive behavior on the part of their children. So this hikmat or wisdom is also mentioned. And for teenage boys and girls themselves, like having insight into their ongoing systemic changes can overcome their emotions and mood swings, and when they try not to be swayed along with the hormonal fluctuations. So they can control what is going on, like if they know it's happening, so they can control. Some suggest, yes, some suggest use of omega-3 fatty acid supplements or flaxseed oil preparations as a natural therapy to control these changes at puberty. And this is the article on flaxseed, use of flax seeds. And this article tells us that flaxseed has powerful properties when it comes to hormonal troubles. Inside these small brown seeds are compounds that help restore hormonal health in how they work, how these flaxseed work. It is mentioned. You can check on the like later. You can check this article, or you can go on the internet and see these things. So these are some natural supplements, natural supplements that can help during around puberty, to help to help during with these challenges. And yes, like like social life, socially, uh, a happy family time or vacations spent together may also have a special uh, healing effect, right? So now we come to the second on my list, this like episodes of anger or unknown fear or despair that happen around puberty. And they are also, as we just learned, mm, the physiology of amygdala and the hormonal fluctuations. So these changes, like the episodes of anger, unknown fear, or despair, also result from hormonal changes around puberty. This is a fact about physiology, but there is an environmental effect also. Why? Because adolescence is the phase of human life that also coincide with academic and social challenges. Social pressures associated with seeking college admissions, preparing for employment, and pursuit of a sound career also contribute to the causation of these episodes. So it's not only that they are like biologically there's a pressure, there is a build up within the system, within the body system, but environmentally there's a stress factor. So both factors compound each other. However, again, realizing and appreciating the basic fact about human physiology, my sincere advice to teenagers is that do not let these stresses overcome you, and do not let them grow out of proportion. You can embrace them with firm faith, hard work, and positive attitude. The thing is, around puberty, sometimes you belittle yourself. Like when you have feeling of despair or hopelessness, you belittle yourself. You still don't know how much potential Allah subhanahu wa ta'ala has blessed you with. So you need to explore that potential. Whenever you feel hopeless, always remember, fears may be as false as hopes are often deceiving. Besides these episodes of anger and other changes, there are changes in the behavior, overall behavior and thinking pattern also. Like it is usually observed in a certain percentage of teenage boys and girls. So it's not 100%. Like these changes, behavior changes may not be in 100% of uh, teenagers, but it's a general observation that they like there is an urge to become socially independent. Like they have an intrinsic desire, maybe premature desire. If they, if anyone wants to become socially independent at age of 13, 14, obviously it's a premature desire, and there are conflicts over parental control. Like they around this puberty years, uh, kids who are very obedient, they are becoming uh, defined. Like they become defined. So there's a problem of obedience versus defiance. And one more thing that that is observed is that there is a tendency to forget, neglect, or overshadow the childhood memories. They don't recall the childhood memories, but they more focus more on the future, like constantly thinking about the future rather than cherishing precious past memories. Uh, so these changes are observed uh, in teenagers. And obviously, there's initiation of sexual inclinations. And one more thing that is there, like they tend to spend more time with friends, and they they really don't spend that much time with their parents and family members. So around puberty, where you um, most girls and boys, they spend more time with friends. So that's also an observation. Okay, the fourth one on the list is initiation of romantic crushes around puberty. Um we all know the crushes when suddenly you start constantly thinking about a particular person. uh, in the following slides, we are going to learn more about crushes. So this definition is from, again, internet, and it's a strong feeling of romantic love for someone that is usually not expressed and does not last a long time. And in one article from Elite Daily, clinical neuropsychologist Dr. Rhonda Freeman compared the phenomena of having a crush with the addiction to drugs. Difference being in difference being in crush, someone is addicted to the thoughts of a person instead of drugs. She also alluded that the specific chemicals released when someone experiences a crush are norepinephrine, dopamine, and endogenous opioids. Endogenous opioids, also called enkephalin or beta endorphin, and all these three are neurotransmitter in the brain, and these also circulate throughout the body, causing as a whole feeling of arousal, euphoria, or enjoyment. So when they are circulate, they are released in the brain, and uh, mm, these chemicals circulate throughout the body. They cause a feeling of euphoria or enjoyment. Euphoria, you all know, it's a mental state of feeling well without any external legit stimulus. So it's a false sense of well-being. And with dopamine and norepinephrine, there is a heightened level of attention and focus also. Separately now, like there is an increase in heart rate, also feeling of arousal and sweaty palms. Dopamine specifically improves mood, attention, and motivation, making someone feel more energized, attentive, and motivated. Every time someone thinks about his or her crush, text, or be with the person, these chemicals are released. Soon the person becomes addicted and starts craving for the next text message or even the thought of his or her crush. So these things, like these neurotransmitters don't last they have a very short half-life, and these don't last in the circulating blood any longer. So these things like mood, attention, and motivation, it's a very short-lived. So it comes and goes. Okay, so here are some psychological facts about crushes. When you have a crush on someone, your brain overlooks any flaws the person has, causing them to appear perfect in your mind. And the second fact is crushes last about 4 months. This is also from Google search. And yes, this is about like the comparison between crush and actual love. So it's an analogy, like comparison between the two is like renting an apartment for a few months versus owning the house. Crush is a temporary phenomenon. It comes and goes, while love after marriage is longer lasting. Another comparison with a different perspective. When people are having cold, they think they need antibiotics because of bacterial infection. But most of them do not actually need it. We know that most of the cold and flu patients, they don't actually need it. The viral infection resolves on its own. Same goes with crush. People think that it is love, but actually it's not. Like if someone is like just started experiencing a crush for third week, fourth week, he or she doesn't know it, that it won't last more than few months. So they think like it's a longer lasting thing, and I'm in love, but it's not love. However, one must take precautions in order to avoid complications. Why complications? Because when someone constantly think about a person, like waiting for the text or like every now and then thinking about the person, so it causes distraction and divergence from main objectives of anyone's life, and it also raises family conflicts, because obviously like there's a variable acceptance across different cultures, like in culturally and religiously, obviously it's not welcome. So there may be family conflicts. Most crushes start with one more thing. Most crushes start with innocent social interactions, just as texting or calling, but at times may lead to some indecency. So one should take precautions, like not to overindulge, and there are ways to control. So what to do when you or someone else around you is experiencing a crush? First thing, Like, do not take crushes so seriously, because it's a fact these come and go quickly. Uh, a, uh, a boy or girl 14, 15 years old, because he is just entering into the puberty, he doesn't he may not appreciate this fact that these come and go quickly. But an adult person, 22, 23, 25, 40 years old, um, would tell you that yes, there are crushes come and go very quickly. It's a fact. And the other advice is, do not blame anyone having a crush on someone. It's like this is coming out of a natural phenomena. So, like, thinking about any person is not sin, but acting on that thinking, then it becomes sin. Like, thought comes, thoughts coming into the mind, like it's coming, but you can manage your thoughts. So, do not blame anyone having a crush on someone, but try to help him or her morally and socially. Do not talk badly about that girl or boy. Avoid scandalizing anyone. Advise them to maintain social distancing. Yes, if someone is having crush on another, like a classmate or any other person, maintain social distancing. Like, avoid spending time with the other person, your crush, in seclusion. So, because it facilitates indulging into something that is inappropriate. And avoid shipping. Do not relate two friends in a specific meaningful way. Like, where friends, they this is absolutely not appropriate. Uh, Shipping two people together, if it as if you are collectively forcing them into a relationship. So this is again from internet, a sincere advice you can give someone experiencing a crush. Uh, Distancing yourself, distance yourself from them, remove their contact information and text messages, remove them from social media, stop talking about them, don't allow yourself to think about them, ask your friends not to bring them up. So these are some advice on the internet. Now, what our religion, Islam, guides us in this regard. Um, Islam prohibits gossips about immoral, indecent conduct. Like, if uh, you have seen something inappropriate, even if it is real and present in the society, but should not be repeatedly talked about. You saw someone with somebody else, but uh, like, it should not be repeatedly talked about. This is from Surah Nur, Surah 24, ayat 19. Islam prohibits slandering someone or make scandals about someone. Like, slandering is prohibited. And also, Islam teaches us to guard personal decency and take precautions to avoid those situations that are considered inappropriate for cultural and religious perspective. And from these, we know that it is not permissible for a man to be alone with a woman. Okay, when, like, overall, like, overall guidance for emotional challenges, like, if there are episodes of anger or hopelessness or fears, constantly thoughts of you are experiencing thoughts about hopelessness or fear. experiencing some fear. So, or sometimes when you are not able to focus or manage your time because of heightened anxiety, like anxiety of exams, anxiety of finals, something like that. You recite this surah again and again. This surah along with Surah Falaq. Mm, this is the 114th surah. So Surah Nas, you repeatedly recite and ask like help from Allah subhanahu wa ta'ala directly. Like relate to Allah subhanahu wa ta'ala, ask directly, and try to learn the meanings. When you recite the surah with the meaning in, you know the meaning, then it becomes more effective. It has your feelings. It becomes your feelings. So try to learn the meaning of the surah and then recite it again and again. So that's the end of the discussion from medical as well as religious perspective. And these are some take-home messages. The first thing that we learned, that the emotional challenges of puberty basically arise from cyclical hormonal changes and their consequent early systemic body response. Because these things are physiologic going on in the body, be mindful of your own emotional instability. Do not let this phenomena take your sanity away. So if you are feeling hungry, try to control your anger, try to control your emotions, be optimistic, think positively. Remember, fears may be as false as hopes are often deceiving. Do not take crushes so seriously. These come and go quickly. Remember, importance of a happy family life. Try to maintain it at all times. Because these like crushes, these are because this is kind temporary thing. So for us, for just a temporary feeling or temporary thing that is going on in your life, you must not put your family life at stake. So try to maintain it at all times. Becoming independent, yes, becoming independent is important in adult life. But before actually entering into adulthood, preserve and cherish your family ties. Spend good time with friends, but please do not ignore your parents and other family members. Stay positive, stay healthy. Thank you. Thank you for listening to this discussion. I hope this will help in understanding the physiology, the processes behind these puberty changes, and help you and your family overcome these changes. Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh.